With all the information we've covered, the more important aspect to consider is the impact to your patients. As you provide care to your patients, here are some questions you can ask yourself. What difficulties are your patients and their families encountering with their commercial and government payers? How are the narrowing provider networks impacting them? How are payers determining what healthcare services will be covered for the patients? What is the financial impact to patients around more co-payments, deductibles, and other out-of-pocket expenses? And are patients becoming more questioning and discerning about the cost and quality of the services they receive? As a nurse leader, you should be able to answer each of these questions. Keep in mind, the individual patient consumer has historically been insulated from the true costs of medical care. The patient is typically unaware of the costs because the providers and the hospitals send their bills to the insurance companies and Medicare or Medicaid. The patient often only sees the final bills with the balance that they are responsible to pay. So it's vital that you and your team understand and are able to help the patient navigate this changing landscape of reimbursement of services. It's also vital that you understand ways that the patient might be able to meet their needs more cost effectively, perhaps even by using other services in the community. Let me give you an example around reimbursement. Tina is a clinical trial nurse. She's been working on a project funded by a research grant that is no longer being funded. The insurance companies consider the work to be experimental, so they won't cover it. So what does that mean for Tina's patients? Are the research studies no longer available? How will the patients be transitioned out of the study? Tina or her organization will want to talk with other agencies to see if they're willing to cover any aspect of her grant. With accountable care organizations, more integrated care delivery systems, and narrow provider networks, clearly there are many changes that have a significant impact to patients, students, and anyone engaged in the healthcare industry.